All right, so the past two lectures, we've talked about just the different anatomy of the foot and ankle. Right now, we're going to start getting into how do you evaluate injuries to the foot and ankle. And then in the next few days, we'll start talking about what injuries are associated with that, and then also how would you test to, I guess, decipher between if it's this injury versus that injury. So this evaluation, these slides are a little bit specific to the foot and ankle, but a lot of evaluation is the exact same process. So doesn't matter what part of the body. So we'll talk about that right now. All right, so very first thing as an athletic trainer is you're definitely wanting to first make sure that there are no life-threatening injuries. Once you're able to figure out that there are no life-threatening injuries, so that's where things like diabetic coma, cardiac arrest, any type of like severe bleeding, things like that, if those are not happening, then you're going to focus on the secondary survey, which is where you're treating the more minor injuries, and I'm calling them minor. It says major right here. But the more minor injuries because they're not as life-threatening, but they can still be major. So a fracture obviously can still be a pretty traumatic injury, but it's not going to be as major as maybe something like cardiac arrest, a neck injury, so forth. So anyways, you're always then checking for the vital signs because your vital signs can tell you if something more serious is going on. And then you're going into your musculoskeletal assessment, which is what we focus on in this class. And then it just says document everything. So you're always wanting to make sure that you're keeping record of all of the things that you've done when you are treating someone. It's very similar to a registered nurse in a hospital setting. They're charting. If you're working as an athletic trainer, or somebody else in sports medicine and you're covering a game outside, you obviously don't have access right away to some type of, electronic medical record system. But you want to make sure you're documenting everything because if something were to come back and, the person might say, well, they didn't do this, or there was an error, maybe done decision making wise, you will have documentation of that. All right, so the HOPS technique is how you do an evaluation for any type of injury. And so when you work in healthcare, sometimes it's also called a SOAP note, but just know HOPS and SOAP notes are the same thing. It's just the steps that you take when you do an evaluation, and then what falls into each step. So the very first thing that you need to know is that HOPS stands for history, observation, palpation, and special tests. Sometimes it's called HIPS. So history, inspection, palpation, and special tests. So this is how you do your assessments. This is how I do my assessments in my training room. And I'll kind of go into each component within these slides. So the very first part of your evaluation is always starting with your patient history. And that's the same thing if you plan on doing something outside of sports medicine. You're always communicating with your patient if they are conscious and just asking them what happened. If you were able to witness it, then you're going to just kind of document you saw what happened, but you're trying to get information from the patient and then also about what injury happened. This is one of the most important parts of the evaluation process because they're going to tell you essentially how it happened, which can lead you to a lot of different findings. And then you usually will ask things like, do you have pain? Where is it located? That sort of thing. That's going to also lead you to really important things as well. And then two, you're asking them for previous medical history. So if we're focusing on the foot and ankle right now, somebody comes in complaining of pain in their foot or their ankle, I might ask them, have you had this injury before? Because if that's the case, then this might be the difference between someone having an acute injury versus a chronic injury. And then that can also help you down the road when you're trying to figure out what exactly is going on. And then history of the present condition. So is it something that just recently happened and you're walking into the training room because you're in a lot of pain? Or is it something that's been bothering you for a period of time? Then that might indicate that it's something more chronic. You want to start with more generic questions first. So depending on where you're going or working, sometimes they have forms where the person's already filling out like their age, occupation, etc. But you're going to ask them what their chief complaint is. So the chief complaint is, what is their biggest reason why they're there? Is it because they're in excruciating pain? That might be their chief complaint. Is it that they have no range of motion anymore? Is that their chief complaint? So it's whatever the thing that's bothering them the most about their injury. Age is going to matter, and that's just because for like high school students, they are still growing. When you're in a college level or, professional sports wise, they're not growing. So it's going to vary on like recovery time, things like that. What position do they play in their sport? What sport do they play? That's also going to matter, because let's say person is injured, you're trying to then limit them for practice. So they're still able to practice, but can't fully practice. You need to understand what position they play and maybe how to modify their position, what their general health condition is. So are they somebody that's very physically active? It's not the start of the season. So I know for me, like cross country as an example, normally when they just are starting their season, there are a lot of kids coming in with shin splints. And we'll talk about what shin splints are, but that's going to matter because, you're going probably from not exercising as much to all of a sudden, having more grueling practices, things like that. And that's kind of where the activity level comes in. And then also, are you taking any medication? Because that's just important to know, especially if you're referring someone to maybe the doctor or calling 911. So the history of previous injuries. So you're going to ask them that, obviously, and then you're going to say, what happened? Who did you see for this previous injury? Did you see a doctor? Did you treat it yourself? That's going to matter, because if they said, I sprained my ankle, and you're like, who diagnosed you with that ankle sprain? And they're like, well, my grandma did. Maybe grandma is in healthcare, maybe she's not, but it's going to matter. Who did you see? Are they somebody that's credible? What did this person tell you? Did they diagnose you with something? That's going to matter. How long were you out? Again, that's going to matter, because that could potentially cause you to be out for longer with this current injury. Did it fully go away, or is it something that you're still battling and you haven't, let heal? Then you're going to ask them, what is the mechanism of injury? So your mechanism of injury is just, how did it happen? So these 5 terms are just different like examples of those mechanisms. So something like a tension mechanism of injury would be where there's like a pulling, like you're pulling on a rope type of thing, and that can cause like a sprain, a fracture, a strained muscle. So anything that's going to overstretch the tissue or bone. Torsion would be if it's like a twisting mechanism. So like a rolled ankle, that sort of thing. Sprain, fracture could come from this. Compression would be, did you have like direct trauma to it where you hit by, maybe another player's helmet, or I don't know, did you run into something? Those are typically going to be things like contusions or fractures. Your shearing is going to be where it's like it pulled away, and that can be your fractures and sprains. And then bending, like an overbending, not in the joint, can lead to a fracture. And then these are just some examples of how you typically can sprain your ankle. So this one you're going to want to know for when we go into ankle sprains, but an inversion ankle sprain or a lateral ankle sprain is the most common form of an ankle sprain. So inversion means that your foot was pulled inward. And when you pull your foot inward, so if you roll your ankle going inward with your foot, you're going to put stress on everything. So everything on the outside is going to be overstretched. So the whole lateral compartment of your ankle is going to be overstretched, and then that's where you're going to have that tearing. So that is called a lateral ankle sprain or an inversion ankle sprain. Opposite of that, you can also roll your ankle inward, which is or not inward, but roll your ankle outward. So it's called inward versus outward based on the direction of the toes. So your toes are going inward or your heel is going inward for an inversion ankle sprain, and then your toes or heels are going outward for an eversion ankle sprain. And so opposite of that, instead of the outside being on stretch, the inside, so the medial part's on stretch. And so then those ligaments are going to be torn. So your eversion ankle sprain would be that. Then you have the other type of ankle sprain, which is called a high ankle sprain. So if you remember, you have ligaments all over your foot and ankle, but you have ones that connect your tibia and your fibula together. It sits in between. It's called your interosseous membrane. You can sprain that part as well. And that's usually due, if you look at this image, to like a twisting mechanism. So maybe your foot got stuck in the turf and then your body starts to rotate a little bit and your foot's still planted, then you can tear the ligaments in there as well. All right, when you are taking your patient history, you also want to ask questions regarding their pain. Pain is like one of the best indicators that something is going wrong. It's your body trying to tell you something. So the PQRST stands for provocation. So what is causing it? Is there anything that makes it feel better? Is resting something that makes it feel better? Quality would be, what does it feel like? So do you have any shooting pain, which might indicate a neurological symptom? Does it feel stabbing? Does it feel crampy? So again, the pain quality is going to matter. Where does it hurt? So that's your region. I usually will always say, can you point to the spot that hurts the most? Because sometimes they will have pain over a large area, but they might still be able to pinpoint the exact spot that they have pain. So you're just asking them that simple question. Severity, so 1 to 10, I usually will say 1's like barely any pain, 10 is like I want to chop off whatever body part it is. And then just keep in mind, this is obviously subjective. So some people have really low pain tolerances. So they might say, I'm at a 10 out of, 10. And you're like, really? You just like stubbed your toe. Again, just that one you're not going to use as your number one guiding, I guess, response, but it does matter. And then timing. So does it hurt more so in the morning? Does it hurt worse when you're practicing? Does it get better when you practice? For how long is it bothering you? Is it constant, etc.? And then these are just some examples of different types of pain and maybe what structure could be damaged. So you don't need to necessarily write this part down, but just know that like a cramping, dull ache could be muscle related. Dull aching though could also be ligament joint related, so just soft tissue related. You're more sharp, stabbing, lightning like, zapping, burning. If it radiates from the spot, then that's going to be more neurological, so nerve pain. Deep, nagging, dull could indicate bone. Sharp, severe, intolerable is probably a fracture. So, knock on wood, I've never fractured anything, but I've dealt with people that have broken bones. And one of the telltale signs is just the level of pain that they're in. So, if somebody is complaining of a lot of pain, and again, going back to the pain scale, some people can't handle pain the same as others. But if somebody is in severe pain, always best to just err on the side of caution and maybe get them to go to the emergency room, urgent care, and get an x-ray just to kind of rule that out first. And then your vasculature, so your blood vessel pain, is typically going to be like throbbing, and then it says diffuse, so it's going to be more spread out. Within your history, you're also going to want to ask questions about, did you hear any sounds? So did you hear a pop, crack, snap? So this could indicate potential for like a completely torn tissue. So it could be, that snapping feeling. You could have completely tore one of the ligaments in your ankle, cracking. All of these can indicate that maybe there's something more going on. And then did you feel anything unusual? So did it feel different than something you've experienced before? Have you never experienced it, etc.? And then if you look at this image, there was an arrow. That person's ankle either is dislocated or broken because, it's literally in an L. Within your history, you're obviously going to have your previous history questions. So have you damaged it before? Do you have chronic ankle instability? So chronic ankle instability would mean you've already torn the ligaments in your ankle. You maybe have never done anything to correct them. You roll it so often that now it just doesn't have its stability. And so that's going to indicate you're going to be more prone to probably rolling your ankle. And then your mechanism. So with the ankle specific, you have your inversion, eversion, plantar flexion, and dorsiflexion. Your location in the foot and ankle. So these are all just the different anatomical spots. It's going to help you to determine what might be injured. So if you're pointing to your heel, obviously we're dealing with the structures that are around the heel. And then big thing with foot and ankle is checking their footwear. So I will often ask if somebody's talking about ankle or arch pain or even knee pain, I will have them take off their shoes and kind of just show me what their arch looks like. Because depending on your arch, remember, is responsible for supporting body weight with movement and absorbing, that body weight. If you do not have high arched feet, or maybe your feet are really flat, you might be more likely to develop foot and ankle injuries. That's not always the case, but that's usually some spot that I start, and that can help me further with my history. All right, once we get into the O part, so you have your observation. So the very first thing you're wanting to make sure if this is an injury, during a game, is that athlete moving? Are they sitting in a position where, maybe they're grabbing at the side of the injury? Obviously, this person has experienced a lot of pain and they're holding their leg. This is a fracture. So that's going to tell you kind of what's going on. Are they conscious? So do I need to call 911 before I even get to my patient or assessing them? You're going to look at that injury site, and then depending on if they're conscious or not, or is not showing signs of life-threatening injuries, then you would get into your secondary survey, which is where you're then treating for whatever injury is occurring. So if we're looking at this image, he is conscious, clearly in a lot of pain. So primary survey would be that possibly not life-threatening. You would want to check vital signs though still, and probably treating him for shock. But then you're going to try to deal with this secondary injury or secondary survey injury, which would be that ankle. With your observation, you can ask them or seeing when does the pain begin. You're always wanting to check each side bilaterally to see if it is normal for that person. So what that means is we will get into orthopedic evaluation when we are able to do hands-on. You're always checking the uninjured side first and then checking the injured side. And the reason why is you're wanting to see where your patient's like baseline is, because some people might have more movement in their joint and that's natural. So you're wanting to make sure that what you're checking, if there is like a weird difference or it seems like this person has a lot of movement in their ankle, but their other ankle has that same amount of movement, then you might not be worrying that that's the issue. Or it could be this ankle, you're just looking at it, observing it. It is very swollen. It looks deformed. It does not look the same as the uninjured side. Ecchymosis is bruising. So if you're, looking at that and observing all of that, then that's going to indicate that something more serious is going on. With observation, you're also checking gait. So gait would be, how is the person moving? Does it look like they're limping? Does it look like they're in pain when they're moving? Gross motor function, so are they able to fully do whatever range of motion they need to be doing for them to maybe walk or in their position? Posture position, so does it look like they're bent over? Does it look like they're obviously looking at facial expression, does it look like they're in pain? Guarding would be, if I were to come up to this guy and maybe touch his ankle, is he allowing me to touch him, or is he pulling his foot away from me, or just like not letting it relax? And so with the observation, gait would be, again, how the person walks. So if they're having difficulty walking, that's called antalgic gait. Does it seem like this athlete is favoring one foot? So are they not putting weight on one side? Is the athlete walking on their heel versus their toe? So that can indicate that maybe you're having trauma in either of those. So somebody's walking on their heel, they might have pain in their like mid-foot to toe area. And then opposite of that, if they're walking on their toes, they might have heel pain. And then when this person takes off their shoes, do they still have that arch? So that kind of goes with the whole discussion I was talking about, how people who are flat-footed sometimes are more prone to injury. It's not always the case, but if they are standing and their foot is flat versus when they're sitting, they still have that arch, then that might mean something else is going on as well. And then your observation, can the athlete move the limb on their own? So can they wiggle their toes? Can they, maybe you'll ask them, can you wiggle your foot around? And then same thing, is that arch being maintained both when they're sitting and also standing? All right, this will be where we leave off for today. So I want you to just read through this. You do not need to write it down. But if an athlete comes into the athletic training room complaining of pain on the lateral aspect of his ankle, he said he stepped off the curb funny and heard a pop in his foot. Now he is feeling sharp pain and points to the lateral aspect of his ankle, just anterior to the lateral malleolus. You inspect the ankle and find edema beginning to form around the lateral malleolus. So all of this is just a simple example of a patient scenario. And like normally when we're in a classroom setting, I have my students highlight this and they kind of figure out what the important stuff is from this scenario that they would want to pool that can help them to figure out what the injury is. But I'm just going to show that to you guys on the next slide. So all of the things in red are all of the things that I would be looking for if I were to be doing my HOPS assessment. So with the limping, that's observation. So I'm looking to see, okay, he's limping. That's going to indicate that maybe something's going on. Complaining of pain, so that's part of your history. Again, pain indicates that something is going on. Pain is your body telling you that something's not right. They have pain on the lateral aspect of the ankle. Okay, so now I'm going to start thinking of all of the different things that anatomically could be injured on the lateral part of the ankle. Okay, he stepped off the curb. Well, that's your mechanism of injury. How did it happen? Oh, and he also heard a pop. Okay, so he's having pain on the lateral side of his ankle. He stepped off a curb, maybe rolled it, felt a pop. Okay, that's going to tell me that maybe he, has an inversion ankle sprain because he rolled it and has pain on the lateral side. Okay, now he's experiencing pain just above the lateral or just in front of the lateral malleolus. Again, that's going to tell you location. You're inspecting, you see that there's swelling. Okay, now that means that there's definitely something going on because your body doesn't just swell for no reason. States that his pain is a 6 out of 10. Okay, it's not, he wants to chop it off. He's not in excruciating pain, but it's definitely uncomfortable. So with like a 6 out of 10, I'm probably not going to call 911. If the person's saying they're at a 10 out of 10 and a bone is sticking out, then I would call 911. And then he can't put his, like, all of his weight on his ankle. So that, all of this stuff, I don't expect you guys to be able to figure out what the injury is yet. But for me as an athletic trainer, it helps me to discover that he probably sprained his anterior talofibular ligament. So again, don't expect you guys to know that, but this stuff helps me to kind of figure it out. All right, we will stop there for today. We will continue with the PNS tomorrow. So just make sure you turn your notes by the end of the period, and I will see you guys tomorrow.